By 40 years of age, 50% of British Columbians have had or will develop a mental health problem, and about 1 million of us experience a mental illness each year. It could be your colleague, your neighbor, your friend, your spouse. Someone you know is probably struggling with anxiety, depression, or trauma. But the sad reality is most won't actually get the help they need, believing therapy is too expensive, it takes too long, or it's too hard to find the right therapist to fit into a busy professional schedule. So instead, they'll try and help themselves. They'll read self-help books, listen to podcasts, and try affirmations and positive thinking. And when that doesn't help, their doctor might prescribe medication. And unfortunately, the vast majority of professionals suffer in silence, though, turning to self-medicating with drugs or alcohol. Sometimes they'll pull it together and function like that for years, living the lie, looking in control on the outside, but chaos on the inside, secretly feeling like an imposter, believing they're not good enough, they're unworthy, they don't belong, or in some way they're defective or broken. Eventually they'll turn to a coach or a therapist when it feels like the wheels are going to fall off. But unfortunately, they're not out of the woods yet. They may feel better at first having someone to talk to, and benefit probably from learning a breathing exercise or a grounding technique or even journaling. But most will eventually stop going to therapy when life happens and they're back to old patterns. Why? Because the myth as to how and why change happens is outdated. Talking leads to insights, but insights don't lead to change, especially if the person has experienced trauma, which, by the way, is any life experience where the individual felt overwhelmed and powerless. Talking triggers painful memories from the past, and the nervous system re-experiences them in the present moment. But we can't stop there, because change actually occurs when the brain recalls a distressing memory and the body and nervous system have a different experience, one that's neutral or calm. Talking is just a left brain approach, but we need the whole brain and nervous system on board for change. And this is what EMDR does. Using a process called bilateral stimulation, we activate both hemispheres of the brain in alternating fashion, moving clients beyond their painful memories and bringing their entire nervous system up to date. Just like installing the latest software on the fastest hard drive. With EMDR, symptoms of anxiety, depression, and trauma simply melt away, rewiring the brain and nervous system for optimal levels of happiness and success. With EMDR, there's no homework or medication required, and the results come quickly. At Grigore Counselling Associates, we've raised the bar with cutting-edge EMDR techniques that ensure our clients receive life-changing results as fast as possible. To see if our approach is right for you, book your free consultation today. You'll be greeted with calm, compassion, and acceptance from an expert no matter what you're dealing with. Your future is just a few clicks away.